Thanks for joining us. I'm Ken Durdahl in for Janet tonight. Well, the holiday season is officially over, and I hate to be the Debbie Downer here, but for many of you, it's led directly to seasonal illnesses. This week, the CDC issued a warning of surges for COVID, the flu, RSV, and norovirus. And because nobody wants to contend with all that in the new year, we sent Sammy Salina to find out what we should look out for here in Minnesota. Hi, Sammy.
Hi, Kent. Yeah, it's bad here too. Holiday gatherings certainly didn't help the spread, and now cases are rising. If you feel like everyone and their mom is getting sick right now, you're on to something.
How do you think you got COVID?
Well, it was from our Christmas celebration. There were 3 of us in the family that ended up getting COVID and was not expecting it.
Linda Berglund didn't think she would get this sick. She's updated on her flu and COVID shots.
Thought it was just a bad cold, but then someone else called and said that they had COVID.
She knows quite a few people who aren't feeling great right now.
Maybe 2-3 weeks ago, we were seeing a lot of norovirus. Now we're seeing a lot of viral URI, so COVID, influenza, RSV.
Dr. Lucas Dingman works in the Hennepin County Medical Center Emergency Department. He says they're doing their best to keep up.
We actually had our busiest day of the emergency department was on December 27th. I think we saw 365 people in that 24-hour period.
And what they're seeing aligns with the Minnesota Department of Health's weekly viral respiratory illness report. There's been a sharp increase in the proportion of visits to the ER for flu and COVID-like symptoms.
We're seeing a lot of all 3 right now. It is kind of the expected time of year that we see respiratory illness start to rise, especially after the holidays.
Melissa McMahon is the supervisor for influenza surveillance at the Minnesota Department of Health.
It's not unusually higher this year. COVID has remained largely the same from previous weeks, and flu and RSV have both increased quite a bit, with flu a little bit higher than RSV.
McMahon says it's not too late to get your shots. It's the best form of protection.
Most vaccines are not a 100% cure-all. You are absolutely never going to get this disease, but they're still the best tool that we have in our toolbox.
Hospital workers say it would help them out if you did what you could to prevent the spread.
If the symptoms are severe, so you're having severe shortness of breath, chest pain, dizziness, lightheadedness, severe vomiting, those are all really good indications to come into the emergency department.
They ask that you do what you can to stay healthy to help lighten their load. Linda would tell you, do yourself a favor and try to protect yourself from any sickness going around.
Well, I have not felt real well. Still have the congestion and the coughing, but otherwise on the mend.
McMahon says we will likely continue to see cases rise based on the timing of holiday gatherings. Kent.